Okay, Jose. How you feel? Good seeing you, Jose.
For 70-year-old Tyrone Taylor, a veteran of life on LA's Skid Row,
Here's your
medicine.
delivery, your med.
All right, and I'll see you next time, okay?
Sounds good, brother. Thank you.
regular delivery of his HIV medication is a lifesaver.
My health would deteriorate at my age if I don't have that medication. I'm pretty sure. I don't want to find out, put it that way.
Tyrone, who spent 20 years living on these squalid streets battling drug and alcohol addiction, is recovering, inspired by a reunion with his family. But that progress is threatened by a recent cut in Medi-Cal reimbursements paid by the state to community pharmacies like Bella Vita, which delivers medicine to vulnerable patients such as Tyrone. Roughly a third of Bella Vita's patients are on Medi-Cal, but the pharmacists here say they're losing money on every specialty drug they dispense due to state cuts. Without relief?
We have to cut the staff hours. We cannot afford a delivery service anymore. So I'm very worried because it's not just our livelihood, it's the patient. Our main focus is on the patient. Patient will not get the service they need.
That service includes not just delivering medications, but ensuring they're taken properly. Aggravating the worry, the state has announced intentions to retroactively collect on Medi-Cal claims covering the past 2 years. For the troubled and disease-prone population on Skid Row, which has recently drawn the attention of the White House, the cuts raise worry about access to health care and about threats to public health and safety.
If you think it's chaos now, it will be more chaos then. You know, definitely, 100%.
The pharmacy's delivery driver sees the need firsthand. He says before Tyrone started taking his medications several years ago, he looked close to death.
Well, you could see now how he looks. He's looking good now. Totally another person.
So huge difference now.
Huge difference. It's big time.
Tyrone is grateful for the help and for the care provided by his pharmacist.
Drive safe.
Thank you.
You're all right.
What happens to those on Skid Row if that goes away?
They wouldn't have a chance.
To head off a crisis, pharmacists are asking Governor Gavin Newsom to reverse the reimbursement cuts to stop the financial losses and allow them to continue their work with California's most vulnerable.
But if you realize what we're doing for a lot of people, you're making a big difference, trust me.
A difference not just for individual lives, but for public health as well.